Today's topic for discussion is HIV/AIDS. AIDS is acquired immunodeficiency syndrome. Since the discovery of HIV/AIDS, it has been one of the most devastating conditions which is present in the worldwide. Since the time of its discovery, HIV/AIDS was first manifestation was severe form of Kaposi sarcoma. Later, this condition was renamed as HIV infection and AIDS by CDC in 1982. HIV is known to cause by two main types of virus, that is HIV-1 and HIV-2. HIV-1 and HIV-2 has taken its precursors are simian virus, which is SIV1 and SIV2 respectively. SIV1 is a virus which is commonly seen in chimpanzees, and SIV2 is from Suti-Magambo monkeys. So when these two viruses has been discovered, the manifestations that it has been given are of multiple different types. Coming to about the virus, it is an RNA virus belonging to lentivirus subfamily of retroviruses. This HIV virus is a T lymphotropic virus, and it will affect the CD4 T lymphocytes predominantly. Hence, HIV is also called as idiopathic CD4 T lymphocytopenia. Coming to the epidemiology of the disease, HIV-1 is a worldwide pandemic, whereas HIV-2 rarely occurs outside Africa. This HIV-1 is one of the most commonest condition, that is HIV-1 related AIDS is about 85% of whole AIDS syndrome, whereas HIV-2 it rarely occurs outside the African countries and sub-Saharan countries. Recently, it has been found predominantly in India too. Coming to the structure of virus, HIV virus is a retrovirus which is an RNA virus, and it has an outer envelope and a central nuclear capsid. This outer envelope is a bilipid layer where it has 72 sets of nucleoproteins too, which are protruding out of this envelope. It has a stalk and a cap, where the stalk contains a protein called GP41 and the cap contains 3 glycoproteins, it is GP120. The inner core of the virus is a bullet shape which contains various proteins which includes P24 and P18, and inside the capsid we also have the virus also has various enzymes which is nothing but reverse transcriptase and protease enzymes. This reverse transcriptase enzyme is responsible for the virulence of this virus. Coming to the modes of transmission or infection, HIV transmits in various routes. One for the most predominant route is sexual route. The second one is parenteral route, where there is abuse of the injections, drug usages, and indiscriminate use of the syringes. And next, it can also be transmitted by vertical transmission, that is from the mother through to the child during the time of parturition. And then occupational exposure is also seen in case of healthcare workers. This occupational exposure in dentistry has got less reports, whereas in other medical field, that especially in the gynecology field, there are few cases that has been reported. Coming to the pathogenesis of HIV virus, HIV virus is, as said, infects the CD4 will go and infect the CD4 cells, T lymphocytes, monocytes, and the lymphocytes. When it infects the CD4 cells, it goes through the CD4 receptor, where the envelope proteins, that is nothing but the GP120 and GP41, will go and help this virus to attach to the cell membrane. Once the virus has entered into the cell, it de-envelops itself, and the virion that it is present inside comes out. With the help of the reverse transcriptase enzyme, the viral genome, the viral RNA, will convert itself into a proviral DNA. This proviral DNA, along with the host DNA, it gets mutated, and it gives out it buds into number of HIV viral particles. These outnumbered HIV viral particles will break out from the cell membrane, and thus they actually get this bilipid layer of the outer envelope. The bilipid layer of the outer envelope of these HIV viruses is derived from the lipid layer of the cell of the host. So after these cells outnumber, then they enter into the bloodstream, giving out various different clinical pictures. First clinical picture is an acute infectious period, second is the latent period, and third is the actual AIDS, that is acquired immunodeficiency syndrome. Coming to the acute infectious period, also called as acute retroviral period, is actually a phase of seroconversion. It is important to understand that when these viral particles enter into the human body, enter into the bloodstream, their body takes some amount of time to produce antibodies against these viral particles. This period of time where after the attack of these viral cells into the blood and production of the antibodies, the time in between is called as latent period. During this period, the host still remains infectious, but the actual disease condition cannot be identified from the actual tests like ELISA test and other tests, which are the initial screening. The screening test will not identify this kind of condition in the acute phase. It actually lasts up to 2 weeks. Acute infectious period has various kind of symptoms which will include fever, malaise, lymphadenopathy. There will be generalized lymphadenopathy and patient also feels fatigue. After this, the patient enters into a phase of latency. In acute HIV infection, it is a systemic. The manifestations are usually systemic, which includes fever, weight loss, malaise, headache, neuropathy, lymphadenopathy, and there will be rashes on the skin. Esophageal sores will be present. Patient will also complain of myalgia. There will be enlargement of liver and spleen, which is nothing but splenomegaly and hepatomegaly. Patient will also have conditions like nausea and vomiting. In the carrier state, that is the clinical latency stage, patient will be still infectious, but he will not have the symptoms. So this is called as an asymptomatic stage. In some patients whose immunity is really good can have this clinical latency up to a period of 10 years. Usually in this condition, there will be persistent generalized lymphadenopathy, which is nothing but there will be more than 1 centimeter lymph nodes present in different areas, 1 centimeter to 3 centimeter. This lymphadenopathy will be persistent. That means it will be for a longer period of time. This is the only sign which is usually found in case of carrier state or clinical latency. Next is AIDS, the next stage. AIDS is a severe stage of HIV infection. It is the end stage. Here, it is characterized by opportunistic infections and AIDS defining conditions. What are opportunistic conditions? In opportunistic conditions, normally in the human body, there are certain microorganisms which are normal commensals in otherwise healthy person. For example, Candida. Candida species are present within the oral cavity or in other mucosal areas also. But in an otherwise healthy patient, this does not have any virulence. In case of an immune compromised person, such as in AIDS, where the CD4 count is usually less, these CD4 T lymphocytes help the human body in immunity. When these cells are low, when the CD4 count is low, the immune compromised state prevails. In such condition, the normal commensals itself will turn into pathogens. So these conditions are called as opportunistic infections. And there are certain other AIDS defining conditions which is given by CDC, that is Center for Disease Surveillance. This AIDS defining conditions will actually help in diagnosing AIDS in a clinical way. And the severity of AIDS usually depends upon the viral load and the CD4 count. Lower the CD4 count, higher the viral load defines the severity of AIDS. In AIDS, there will be multi-organ involvement too. And if untreated or if it is not identified earlier, this condition can be potentially fatal. Coming to the main symptoms of AIDS, acquired immunodeficiency syndrome, the central nervous system will also be involved where it will lead into encephalitis, meningitis. Eyes can be involved where it can lead into retinitis. Lungs, that is pneumocystis, pneumonia. Tuberculosis is one of the most common conditions seen in HIV patients. There can also be many tumors like Kaposi sarcoma. In the skin also there can be tumors, and gastrointestinal region will also be affected, giving rise to conditions like esophagitis, chronic diarrhea, one of the most common symptoms in the earlier stage of AIDS, and tumors. These AIDS defining conditions are of various types based on certain bacterial infections like Mycobacterium tuberculosis. Especially Mycobacterium avium complex can be predominantly one of the organisms which will be causing tuberculosis in patients with AIDS. Mycobacterium consanguinea is also one other condition. Coming to other conditions, recurrent candidiasis of respiratory tract, patients will have severe candidiasis. Oropharyngeal candidiasis is one of the most common symptoms in patients with HIV. And invasive coccidiomycosis and other fungal infections like histoplasmosis, toxoplasmosis, cryptococcosis, cryptosporidiosis, etc. They will also have chronic intestinal cytomegalovirus. Other viruses include HIV virus, which is herpes simplex virus, will take a severe form in case of HIV infected patients. There will be CMV retinitis, which is nothing but cytomegalovirus, and they will also have recurrent pneumonia. Other tumors that will be involved in case of HIV AIDS is Burkitt's lymphoma, immunoblastic lymphoma, primary lymphoma, lymphoid interstitial pneumonia. In case of cervical cancer, in case of AIDS, cervical cancer is also seen. Kaposi sarcoma is one of the other pathognomic feature of HIV/AIDS. Most commonly, it involves palate and gingiva in the oral region. Pneumocystic kidney pneumonia is also another feature. Other oral manifestations which can be seen in HIV/AIDS is, as already said, oropharyngeal candidiasis is one of the pathognomic feature. Patients also come with severe aphthous ulcers. These aphthous ulcers are recurrent in nature and the size is usually large, which comes under major aphthay, and the time that takes to heal in these conditions is usually huge, like it is up to from 1 month to 6 months period of time, and definitely they leave, in most of the cases they leave scar. And then they also have necrotizing ulcerative periodontitis. Earlier it was called as NUG, that is acute necrotizing ulcerative gingivitis. But recently these diseases of acute necrotizing ulcerative gingivitis and periodontitis are renamed under a group called necrotizing ulcerative periodontitis. Patients also come with hairy leukoplakia, usually seen on the lateral side, on the lateral border of the tongue, and it is like an elevated region which will have a corrugated pattern. And then they also have angular stomatitis. Patient come with oral warts, and other pathognomic feature in oral cavity is Kaposi sarcoma. Coming to the diagnosis, most important diagnosis is through history and clinical features, and as discussed, WHO has given case defining features of HIV/AIDS, and we also have other serological and blood investigations in case of HIV virus. Coming to the revised CDC case surveillance definition of HIV/AIDS in 2008, AIDS is divided into 3 stages. This is based upon the viral load, the CD4 count, and also the lab confirmation of the HIV. This also takes the the prevalence of these AIDS defining condition in these three stages. In stage 1, the patient may not manifest any AIDS defining conditions, but he or she will be positive for HIV through lab confirmation. The CD4 count is usually less than 500 per microliter, and in the percentage wise it is about it is almost to 29%. Coming to stage 2, in this also clinical evidence may or may not be present, and lab confirmation is positive for HIV virus. And then the lymphocytic count will be about 200 to 499 per microliter. And then the percentage also should be between 14 to 29%. In stage 3, which is a severe form, patients usually manifest with the clinical symptoms, and they will have a CD4 count of less than 200 per microliter, and the percentage will be less than 14%. According to CDC, for the CD4 count, percentage gives a more significant value than the actual values in numbers. Various lab investigations that are used for detection of HIV is primarily ELISA test, which is a screening test. Next, we have Western blot test, which is a confirmatory test. Both ELISA and Western blot detects they check for the viral antibodies, but then antibodies for this virus. But then, as already said, in the period of latency, ELISA and Western blot might not work. Hence, newer generation, that is 4th generation HIV tests have been discovered, where they actually test for the viral proteins. That means immediately when the virus has infected the human body, the viral proteins will be obviously present in the blood. So, these tests will go and check for these viral proteins. Next, we also have tests like HIV viral load and copies and absolute CD4 count, and these two are necessary for knowing the severity of the disease. And other H1 tests include the complete blood count. Recently, point of care or rapid tests have been developed. In this, by using saliva and the blood, patient can detect for virus within their own place. That is, they need not go to the hospital setup. For example, OraSure and recombinant technology, by using recombinant technology, they have been checking for these viruses. Next, we also have virus-linked tests for detection of HIV. Coming to the management, medical management is of 2 prongs. That is, one is directly targeting the virus, and second thing is symptomatic treatment. That is, treating the symptoms, that is the AIDS-defining conditions. The antiretroviral therapy has made a huge development in the recent time, and because of this, the actual prevalence has come down from last 10 years. This antiretroviral therapy is usually initiated by based upon this CD4 count and the viral load. If the CD4 count is less than 350 cells per microliter or the viral load is greater than 55,000 copies, then antiretroviral therapy has to be initiated. Antiretroviral drugs are of 4 groups, and one is fusion inhibitors. Example is enfuvirtide, and nucleoside reverse transcriptase inhibitors, which include zidovudine, stavudine. And we have non-nucleoside reverse transcriptase inhibitors, which are nevirapine and delaverdine. And we have protease inhibitors, which is indinavir and ritonavir. Recently, HART, that is highly active antiretroviral therapy, has also been given for patients who have more severe AIDS. And in this case, a combination of drugs has been used, like 3 NRTIs, 2 NRTIs plus 1 NNRTI, or 2 NRTIs plus 1 protease inhibitors. Apart from the viral therapy, preventive measures has also to be taken care of. These preventive measures include stopping of injudicious use of the syringes, drug abuse, and also unprotective sexual practices. Coming to post-exposure prophylaxis, if at all, in case of any healthcare professionals or an accidental exposure to this HIV virus, there is certain measurements that has to be taken, which is nothing but post-exposure prophylaxis. In this case, by identifying the source of exposure, whether the person is either infected or not infected, the post-exposure prophylaxis has to be started within 72 hours. These antiretroviral drugs are administered in this case to prevent any further progression of this viral load. Thank you.